The 53-day period between October 15th and December 7th each year is a critical time for senior citizens. These dates mark the beginning and the end of open enrollment period for Medicare. Of the 60 million or so Medicare beneficiaries, the Centers for Medicare and Medicaid Services estimate that 24.4 million will be enrolled in a Medicare Advantage plan in 2020. Should you jump in too? Our advice is to take buyer beware approach. Hi, I'm Rick Teska, the founder of Senior Market Solutions, your Medigap insurance advisor. Be sure to subscribe to the SMS YouTube channel so you don't miss out on any of our new content. While the name Medicare Advantage sounds positive, these plans are the perfect example of the old adage, you get what you pay for. Join me for another installment of Teska's Top 10. Today we're looking at 10 reasons you get what you pay for with Medicare Advantage. So let's dive into the 10 reasons you get what you pay for with Medicare Advantage. Number 1, profit-driven plans. With a few notable exceptions, most Medicare Advantage plans are obligated to put shareholders first. They're incentivized to maximize profits and delay and deny medically necessary care. Number 2, still have to pay Medicare Part B premiums. Even though you're no longer using Medicare as your primary insurance, you'll still be required to pay your Part B premium. For most beneficiaries, the Part B premium is $144.60 per month in 2020. Number 3, hard to understand benefits. Advantage plans don't disclose information that allows people to calculate the out-of-pocket expenses associated with costly care. They also make it difficult to easily determine which doctors and hospitals will be covered. Number 4, promised extra benefits can be very limited. Private plans frequently exclude coverage for some benefits Medicare doesn't cover, like dental and vision care. These so-called extra benefits vary widely from plan to plan. People who join an Advantage plan for a specific benefit are often frustrated to discover their plan doesn't cover as much as they thought it would, and sometimes their providers won't honor the so-called extra benefits. Number 5, restricted choice. Advantage plans limit the doctors and hospitals enrollees can use, and they have little incentive to include providers who deliver value in their networks. Advantage plans generally don't compete with one another to deliver value and meet the needs of Americans who need costly care. For this reason, sicker people are more likely to disenroll from them. Number 6, hidden costs. Advantage plans shift costs to people who need care most. High deductibles, copays, and out-of-pocket cap of nearly $7,000 each year undermine access and ration care based on their ability to pay. Number 7, annual plan changes. Advantage plans change their benefits every year, but they're only renewable yearly. In fact, a plan's premiums provide network pharmacy network copays, coinsurance, and deductibles could be different every year. Advantage plans frequently change the medications that appear on the plan's formulary. At times, they pull out of the market altogether. All this means that you must do your due diligence every year. Number 8, unreliable coverage. With so many changes, it's impossible to ensure reliable coverage or continuity of care. An individual's preferred doctor, clinic, hospital might be covered initially, but it's not guaranteed to remain the same from year to year. Coverage can also change mid-year with Advantage plans. Number 9, traveling or snowbird status. Many people with Medicare enjoy their retirement by spending time with family and friends in other parts of the country. Some people live part of the year in warmer or cooler climates. Typically, private health plans only allow members to get covered care within their service area for non-emergencies. For frequent travelers, Advantage plans are often a mismatch for their needs. And number 10, difficult to switch back to original Medicare. If you get sick in the middle of the year, you're stuck with whatever coverage and out-of-pocket costs you incur until you can switch plans during the next annual enrollment period. At that time, you can switch to Original Medicare and purchase a Medicare supplement. However, you'll have to go through health underwriting, and depending on your health, you may not qualify. And that's the 10 reasons you get what you pay for with Medicare Advantage. So you might be wondering where that leaves you. If you're thinking about enrolling in a Medicare Advantage plan, our advice is to shop very carefully. Before you sign on the dotted line, remember these tips. Do your homework and be sure to read the fine print. Don't be afraid to get a second opinion from a trusted advisor. Get a comprehensive list of all co-payments and deductibles. If it's a plan that also wraps in your Part D prescription drug coverage, find out if the plan covers all of your medications that you take. And finally, find out if your current doctors accept the plan. If it doesn't cover your current physicians, make sure you're okay with the doctors it covers and confirm they're accepting new patients. What if you're already experiencing buyer's remorse? Well, we have good news. The Medicare Advantage Open Enrollment Period, or MA OEP, is a lesser known enrollment period that runs from January 1st through March 31st each year. During this time, eligible beneficiaries have the opportunity to make a one-time change to their current Medicare Advantage coverage. For more info, click the link in the description to watch our new video on the MA OEP. If you like this video, be sure to subscribe to our YouTube channel. Click the round SMS button below, or click the link in the description to subscribe to the SMS YouTube channel. We're always working on new content like videos about Medicare supplements, the Tesca's Top 10 series, and the Success with SMS series. So subscribe now.